lost my mom to breast cancer.
Mother's name is Mercy Marachi. She had ovarian cancer and she didn't survive the cancer.
I lost a friend to breast cancer last year.
COVID-19 has had adverse effects on humanity, especially on people with underlying health conditions like cancer. In recent times, sensitization and awareness for a deadly ailment like cancer has been relegated to the background. World Cancer Day is observed yearly on the 4th of February, an initiative taken by the Union for International Cancer Control to sensitize people on the prevention, early detection, and treatment of cancer.
However, the most important thing is testing. If you can detect cancer early, then you can prevent it. And you cannot detect it early if you do not test. Now, that capacity in Africa, not only Nigeria, is quite low. The testing capacity for Africa is very, very low. So we collaborate with international organizations to boost our capacity to be able to do that by getting funding or getting the equipment themselves in to the country for testing to be accessible. Because even when there's testing, the cost of testing also is a challenge.
This mounts a pressure on sensitization and underlines the critical role of cancer prevention as a means to reduce the future cancer burden. Studies have shown that where you live determines your chances of surviving cancer, as there are striking differences in the mortality rates and in the prevalence of certain types of cancer across the world. For instance, while cervical cancer remains a rare case of death among women in Europe and North America, 90% of annual cervical cancer deaths occur globally in low and middle income countries, with the highest burden borne by sub-Saharan African countries.
Cervical cancer kills over 100,000 women in Africa every year. And that figure is going up every year as we know it. The last time the statistics was taken was in 2013. Over 300,000 women already have been affected by cervical cancer, and that is one cancer that can be prevented and that can be eradicated quickly in our society. How do you go about that? There is a vaccine that has been developed to eradicate cervical cancer. Cervical cancer is usually contracted only by women, but the virus that makes it happen in women is carried by men. Now, how do you eradicate that in Africa? Now, what we do is that we talk to young children. You have to get the vaccine, the HPV vaccine, before the age of 13. Between the age of 9 and 13, you have to be vaccinated against it. So once the boys and the girls are vaccinated, they stand the chance of not having cervical cancer in their generation. That is one type of cancer that actually can be eradicated.
Prevention measures include eliminating exposure to lifestyle and environmental risk factors, including tobacco and alcohol, dietary factors, excess body weight, UV radiation, and increasing resistance to infection by vaccination.
Early detection, yes, people know about it. Testing, yes, people know about it, but they cannot afford it. Now, apart from the one that we pay money to know, which other one can we do without money? Your lifestyle. We tell people how their lifestyle can influence, avoidance of cancer. If you live well, eat the right foods, do your exercises, you stand a chance not to have cancer. But most people would eat late, sleep late, take a lot of alcohol, drink a lot of alcohol. All these things affect you. For example, lung cancer is basically from smoking causes lung cancer. Your lifestyle actually is very, very, very important. What do you eat? How do you eat it? When do you eat it? And what do you do with your body? It is good to be active so that the free radicals in our bodies are eliminated at the right time when they're supposed to. Otherwise, they build up. Most of the times, they will tell you, most people that know, doctors will tell you better, are the things that lead to people having cancer all the time. So our lifestyle is does a lot about it.
Many African countries have taken bold steps in addressing the prevention of cancer by developing the National Cancer Control Plans, which has helped surmount the pressures of sensitization. It is evident that increased cancer awareness in Africa is resulting in notable success stories like the universal coverage of breast and cervical cancer services that were recently recorded in Senegal. However, limited access to quality and affordable cancer services, poor surveillance and research structures, and unresponsive health policies to NCDCs remains a challenge that continues to demand a global coalition of actors to improve outcomes in Africa, says Zainab Shinkafi Bagudu, founder, Medic Aid Cancer Foundation, Nigeria. This year, we are encouraged to always remember the enduring power of cooperation and collective action because our actions have an impact on everyone around us. Together, all our actions matter.